Broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. Thanks so much for being here today. We are going to start our trauma-informed care series, and this is a webinar platform, so thank you for watching this video. The slides will also be there for you, so you can complete this lesson within the internal Wellspring Living Institute online. I'm going to go through some of these and then make sure that you all are able to ask questions after you view the video and talk through this with your supervisors. My name's Kendra Hansen. I'm the Institute Director, and I'm here to teach about trauma. So we're going to get started. So today we're going to talk about why we want to be trauma informed, why this is important for all staff at a program like Wellspring or a program serving trauma victims. We'll overview some terminology that you'll probably hear and hopefully feel comfortable with. And then we're going to look at trauma for the non-clinician, because most of those employed at Wellspring are not clinicians, they're not therapists. There are a few or one or two in each program, but the rest of us are not clinicians. And so I'm looking at it from that perspective. Then we'll look at it from the trafficking survivors perspective, as well as organizational awareness of possible effects of trauma. So just things you can do in your workplace and in your program to ensure that participants are getting trauma-informed care. It's up to you. It's up to all of us to make sure that that's happening. And you've taken the first step by viewing this video. So thanks for doing that. So trauma-informed care is really services that are designed specifically to avoid re-traumatizing those who come seeking assistance, as well as staff working in service settings. So this is just making sure that we provide appropriate services to participants who are have been traumatized in some way, and we want to avoid re-traumatizing. So there are some things that we can do. Some of those best practices include what we're going to talk about today. So trauma-focused cognitive behavioral therapy. I want you to be familiar with what that is, not that you need to know how to do it, but just what that is. We want to look at trauma-informed care, of course, as the basis, and then dialectical behavioral therapy. Obviously, we want to look at group therapy, substance abuse treatment, family counseling. All of those things are happening within the Wellspring Living programs. And then use of medications for anxiety. And then, of course, there are adjunct therapies, which we'll talk about, that are, again, always important to look at additional types of therapies that might be helpful for individuals, but maybe not the whole group. These are some best practices, and we really try to implement all of these at Wellspring. Trauma defined. You can see this picture. It's kind of strange, but you see like lots of different kinds of faces, things peering around, peeking out. It gets a feel for what could be happening in someone's brain. But according to the Substance Abuse and Mental Health Service Administration through the government, trauma results from an event or a series of events or set of circumstances that is experienced by an individual as physically or emotionally harmful or threatening, and has lasting adverse effects on the individual's functioning and physical, social, emotional, or spiritual well-being. So experienced something harmful, physically, emotionally threatening, that has a lasting effect on somebody. So obviously trafficking does, poverty, domestic violence, substance abuse, these kinds of things create trauma in people's lives. Neglect as children. All of these various instances work to create a lasting adverse effect on an individual's functioning. And it's our job to serve these individuals in the best way possible and give them options for how they experience life and how they can function in society. So some effects of child traumatic stress, which most, if not 100% of our participants have experienced, it affects the brain. The brain, as you can see, has a stem at the bottom, and we have this kind of primitive choices here where we're fight, flight, or freeze, learning that. And if the child is in a traumatic situation or a stressful situation, the brain continues to build on fight, flight, or freeze and making sure that survival is happening rather than this top portion of the brain where you can see that pokes out the frontal lobe. That is your executive functioning, where the brain is thinking through rational thought, complex processes. The brain, if there is significant childhood traumatic stress, is focused on simply surviving, not on critical thinking skills. And so that is a serious effect of childhood traumatic stress. This relates to areas of impairment in children exposed to complex trauma through attachment. They might seem unattached, or they might completely easily connect with somebody and then drop them the next day or the next second. I mean, sometimes that is all of life in middle school. But biology also, trauma affects the brain and the development of the prefrontal cortex, like I talked about, which affects executive functioning and self-regulation, that thought that says, oh, I probably shouldn't do this in this environment or in this situation. Also, abstract thinking and decision making is controlled through that biological piece of the prefrontal cortex. And then mood regulation, you will notice with many of our participants that sometimes certain things set them off, maybe out of the ordinary. For example, reaction to being late or to having a sudden change may have a much more difficult reaction than something you might normally expect with maybe a family member. There is dissociation. You may be talking to them and realize they're not really present, that something's happened and they have mentally disconnected. That happens. There's obvious concern sometimes with behavior control, knowing appropriate behaviors for the environment. Cognition, sometimes due to the prefrontal cortex to develop more slowly. They may not be fully processing what's happening. There's also self-concept, is your very definition of yourself is sometimes broken, especially when there's a victim of chronic interpersonal trauma, which sex trafficking is considered, domestic violence as well. Development, many psychologists state that a person is oftentimes stuck at the age mentally or emotionally where the trauma has occurred. So you may see them acting a certain way indicative of a young girl when they might be 33 years old. There might be attachment to certain objects, naivete, humor, and amusement sometimes are kind of telltale signs of this. What we do at Wellspring, more specifically with the girls program, is focus on trauma-focused cognitive behavioral therapy. And this is something that the therapist does, not other people in the program. But it is trauma-focused cognitive behavioral therapy. You may hear it as TFCBT, an evidence-based treatment for children and adolescents impacted by trauma and their parents or caregivers. Research shows that TFCBT successfully resolves a broad array of emotional and behavioral difficulties associated with single, multiple, and complex trauma experiences. So we provide TFCBT at Wellspring Living in order to resolve emotional and behavioral difficulties associated with the trauma. So it's training the brain on how to think about it differently. That's TFCBT. So that's your other acronym that you'll be familiar with. The benefits of TFCBT to a trafficking victim include that it's proven to show improvement in PTSD symptoms, reactions to experiences that make them think that the trauma is continuing to occur, depression, anxiety, externalizing behavioral problems. They're able to see that they are not this behavior, that it's something that they've developed and learned along the way. Sexualized behavior problems. Shame around what's happened to them, maybe self-blame. Trauma-related cognition, so thinking about it. Helps them resolve and improve interpersonal trust and when that's appropriate, as well as social competence, so being sure of themselves. Now on to the next acronym you might hear, another form of therapy, dialectical behavioral therapy. And this is oftentimes known as DBT. A lot of times in the women's programs, they utilize DBT. So again, it's behavioral therapy. And this is, if you want to look back, is also behavioral therapy. So just to review, they're both kinds of behavioral therapies. So it's a type of cognitive behavioral therapy. Cognitive behavioral therapy tries to identify and change negative thinking patterns and pushes for positive behavioral changes. Very similar to TFCBT. DBT may be used to treat suicidal and other self-destructive behaviors. It teaches patients skills to cope with and change unhealthy behaviors. That's the whole point. So we want to give them hope for change in their behaviors. Dialectical, that word, comes from the idea that bringing together two opposites in therapy, acceptance and change, brings better results than either one or the other. Again, this is also led by a therapist. Oftentimes there's improvement in less anger, social functioning, mood disorders, post-traumatic stress disorder as well. So benefits to a trafficking survivor. It teaches social skills, resolution of conflicts, control of our own emotions, that we can't control somebody else's emotions, appropriate reactions to distressing situations, so learning when and where what behavior is appropriate, self-observation, so learning to know ourselves and observe when maybe we're feeling angry or feeling triggered. And group therapy with DBT is particularly helpful because it's used to correct unhelpful interpersonal reactions and interactions. So you may have maybe seen somebody misread a situation completely or misunderstand a situation and things kind of get blown out of proportion. Well, DBT, when we're interacting with others and practicing these skills, we're able to see those examples for what they really are and talk through them. Trauma-informed care, TIC, trauma-informed care, is an intervention and organizational approach focusing on how trauma may affect an individual and their response to behavioral health services. And we want to do this through three key elements. One, realizing the prevalence of trauma. It's happened to everyone in some regard, although it's going to look different for everyone as well. We want to recognize how trauma affects all individuals and the systems in which they live. We also want to respond by putting this knowledge into practice. So we want to recognize and realize trauma and its effects, but also part of care is responding by acknowledging these things and knowing that they exist and then moving forward to treat them appropriately. So trauma-informed care includes benefits to a trafficking survivor, such as bringing to light the belief that trauma can affect an individual's entire being, physical and mental health. So we want to be aware of that. We want service providers to recognize that individuals may be affected by trauma regardless of acknowledgement or understanding of that trauma. So we may realize that someone has been trafficked or sexually exploited, and they may not want to agree to that, and they may think that that it was all their fault, that they created this situation for themselves. But we want to help them understand that they have been affected by trauma regardless of their acknowledgement of it. Does that make sense? I hope. Service providers also recognize that organizations can re-traumatize clients through standard or unexamined policies and practices. So this is why we're doing this. This is why you're on this webinar, is so that you individually in your area, in your location, work to not re-traumatize and work to examine policies and procedures so as to be beneficial for all of those here. More benefits include providing clients more opportunities to engage in services that reflect a compassionate perspective of their problems. So we want to be compassionate. This goes with the strength-based approach because we might see these behaviors as evidence of their trauma, and it's difficult, especially when those behaviors, those challenging behaviors, are personally directed at us sometimes. We want to acknowledge that that's an external part of their trauma. That's their trauma coming to light. It's not that individual and who they were created to be. It's their trauma's effects. So we want to provide a greater sense of safety for clients with histories of trauma. We don't want to get into it with anxiety and creating a culture of fear, but we do want to make sure that they feel safe and comforted and in order to heal at Wellspring Living. We also know that it offers clients a chance to explore the impact of trauma. We want to give them strengths and creative adaptations of managing their traumatic histories. We want to build resilience among trauma victims and make sure that they are able to overcome those symptoms in their lives. So trauma-informed care begins with the first contact the client has with the organization, with your case manager, with your intake coordinator, whoever's taking on that role. Questions to ask yourself about the organization or the area where you're working. Does the agency monitor who is coming in and out? This is all part of trauma-informed care. Do staff members ask consumers for their definition of physically safe? That's something that we have on our participant assessments currently, is whether or not they feel physically safe at Wellspring. Is the environment well lit? Obviously, when necessary. Does the organization provide consumers with opportunities to make suggestions about improving the physical space? We're not talking about the colors of curtains, but ways to help people feel safe. Does the organization review rules, rights, and grievance procedures? Are participant rights posted in places that are visible? It's in our handbooks. And are materials posted about traumatic stress? This is all the beginning steps of being trauma-informed. So we want to look at some key elements. These you can apply to Wellspring, but these are not exactly Wellspring specific, of course. So this kind of environment is welcoming and child-friendly. It looks like a doctor's office, or pediatrician's office rather. Not child-friendly is going to be this, right? And I'm talking about children, young children under the age of 10 or so. So we want to make sure we focus on creating this safe environment through welcome to clients, assessing their immediate needs. We do this at Wellspring by getting them food and clothing and a safe place to be. We want to make sure we're informing them of what's happening and things that will happen in the program. We want to make sure we go over their rights, rules, and grievances, and that they have access to those so that it's public. And we want the staff to be equipped to listen and to validate. Sometimes people don't feel empowered to listen and validate, but that's a huge part of working at Wellspring Living with participants, is really listening. And a lot of those strength-based tools are going to help you do that. Validate their feelings. Doesn't mean we agree with them. It doesn't mean that they necessarily fit with what's happening in the situation, but we want to validate. It also comes with understanding. So a lot of effects of trauma exposure have an impact on their perception of danger. Many times it's an increased perception of danger, or it may be that completely the opposite, that there is no danger in this kinds of situation. We also want to look at their relationship to the perpetrator. It's not just about the environment and what's happening. We know they're away from the perpetrator, but it's a general understanding. The impact of trauma exposure varies from person to person, and we want to try and understand the relationship to the perpetrator and not just completely tear down that person in front of the participant. That's not our job. There's oftentimes we want to create some understanding with past experience with trauma, adversities faced after the trauma, the presence of support and protection after the trauma. So we want to make sure that they have an understanding and our ability to recognize signs of danger. We want to teach them these things. That's why we look at books like Safe People and Boundaries. So we want to create those appropriate significant signs for in their time here at Wellspring. So the overall goal, of course, is to avoid re-traumatization. I'll put this in the lesson as well. There's a case study from SAMHSA, which is the organization I spoke of before, around trauma-informed care and behavioral health services. So just listen to a minute. It says, even the most standard behavioral health practices can re-traumatize an individual exposed to prior traumatic experiences if the provider implements them without recognizing or considering that they may do harm. For example, a counselor might help develop a treatment plan recommending a female client who has been court mandated to a substance abuse treatment and was raped as an adult attend group therapy, but without considering the implications for her of the fact that the only available group at the facility is all male and has a low historical rate of female participation. So that is re-traumatization, of course. Trauma awareness is an essential strategy for preventing this type of re-traumatization. It reinforces the need for providers to reevaluate their usual practices. So we want to, of course, that wouldn't happen at Wellspring because we're not having groups with males in the home. But we want to make sure that we do hear participants out and listen to these circumstances and think of alternate options. We want to get creative and be curious about what's going to work. So core values of trauma-informed care, which will continue as we go through this series. This is only step one, and I'm coming to a close here soon, is emphasis on relationship. I want to be able to give you some clear takeaways each session. So it's just one small step at a time. We want to focus on, through all of these, the relationship between the person participating in services and the care provider. So we want to give a safe, calm environment. We want to create a system-wide understanding. That means the people we take them to understand. That means the people they interact with through Wellspring Living understand trauma. We want to give consumer voices choice and safety. We want to make sure we give consumer-driven and trauma-specific services. And we want to make sure people are culturally competent. People are aware of the types of services that are needed and what's going on. Appropriate languaging is very important. This is why cultural competence is a mandatory part of direct care training. So how does this impact me and my organization? Want to make sure all staff members are educated on trauma. Want to refine the environment using the environment checklist. We want to post in visible places the client rights, rules, and responsibilities, as well as educate them on trauma. We want to refine safety and crisis prevention plans, making sure that those are up to date for participants. We want to provide ongoing training in trauma and cultural competency, and create an agency for clients in as many ways as possible to empower them with choice for their own care. So thinking through that and what you're learning here in trauma-informed care, I want you to be aware of how that looks in the program in which you're working. Each webinar will provide opportunities for you to take action steps, and during the final webinar, we'll go through a much more extensive list. So we want to be a shift in culture, a system-wide measure of understanding on trauma and its impact. So one of those ways is using the ARC method, and this is for dealing specifically with youth. It's all about that attachment, a safe caregiving system. We want to work on self-regulation, the ability to regulate and tolerate experience. And we want to build competency, support in the mastery of tasks crucial to resilient outcomes. This is why, again, the strength-based approach is so important. Building that competency, that seeing themselves as strong in various areas and giving them exposure to different types of strengths will work in dealing with complex trauma. So the next topics, Trauma-Informed Care 204, will go through some core competencies, trauma screenings, examples. And on 304, we'll look at vicarious trauma and its impact, as well as staff training and assessment, and we'll also look at self-care and how important that is in the work that we do. Here's my contact information if you want to reach out or have questions. Feel free. And these are, of course, the references. And I'll make sure that you get what you need to complete the lesson appropriately. Thanks again for being here.